Welcome, everybody. These notes today are going to be a little bit more difficult than usual. We're going to be starting the muscular system, and the first thing we need to learn when we learn the muscular system is the types of movement. So I need a little bit of space to move around and show you guys some of the movements. But let's get started, and we will do our best as we go. So first thing we're going to talk about, this video I'm going to actually put as an Edpuzzle so we don't have to watch it right now. So again, this is a reiteration of what we've talked about already, but anatomical position is incredibly important in this, and you have to remember that, assume that the motion is starting from anatomical position. Obviously, that's not real life in terms of how people are moving, and when you get into sports physiology, it obviously gets much more complicated. But for the purposes of this course, you really just need to think about people starting in anatomical position and the motion from there. And obviously, motions have opposite directions. So you obviously have to be able to move away from anatomical position and then back to anatomical position. So most motions are paired. And again, before we start with the motions, one of the most simple things to understand with muscles is that their job is to shorten the distance. They contract. That's all they do. And most of the time you have paired muscles. You have muscles that move a joint in one direction, and then in the other direction is another muscle. A really good example is your biceps and your triceps. Your biceps move your elbow in one direction, and your tricep moves it in the other direction. And muscles simply have two ends to them. They are attached to two different points, the origin and the insertion. Sometimes it's a little bit difficult. They're obviously both attached at some point, but the origin is the part that moves the least, and the insertion is the part that moves the most. So in the case of the bicep, that's pretty straightforward. There's actually a good picture on the next slide that I can show you. So this is a great picture of the bicep. So what we see here is the insertion is down here at your elbow, where you are actually having the motion. So when it moves like this, that's the bicep. And you notice it actually has two origins, which is a little bit unique, although many other muscles have that. That is where it actually gets its name, bicep. And as you can probably guess, the tricep has three origins. So we'll get to that. But moving forward, let's go through the main motions here. And this is where I need to stand up and move around. Okay, flexion. First example of flexion is just simply, what you really have to look at is what is happening in the anterior and posterior direction. So elbows can flex, okay? Shoulders can flex and extend. Your hip can flex and extend. So all of those, you can flex your waist, you can flex your neck. And again, the movement in the forward direction is the flexion, and then the movement in the posterior direction is the extension. There is one exception to that rule, and that is with the knee. The knee is a little bit more difficult. The knee flexes, and when it does that, it actually moves the leg in the posterior direction, and then extension is back to the anatomical position. But that's the only exception there. You probably heard a term hyperextension. It's not an actual specific movement. It just means that you're extending a joint beyond its normal anatomical position. And usually it sometimes can cause damage, obviously. All right, specialized one. And I'm going to have to use my balance here, but what we're going to do is with the foot, okay, plantar flexion is moving the foot down and pointing that way, and dorsiflexion is pointing the foot upwards, okay? This motion is only going to occur in the foot, nowhere else. There's not another part of the body that does plantar flexion and dorsiflexion. Okay, but this is important, obviously, in doing things like running and walking. So, abduction and adduction. So here, what we're going to imagine is our midline again in our body, and that imaginary dotted line right through the center from our nose through our belly button. And abduction, these words are confusing because they look very similar. You have to be very careful when you read them. Abduction is movement away from the midline, and adduction is towards. Okay, so arms are something you can do there. Legs can be abducted and adducted. Your hands can be abducted and adducted. Obviously, that's a little bit different. It's the midline of the hand, but it's the same basic idea. But those are the main things. Mostly it's the limbs that we're talking about. Pronation and supination is really very specific to the wrist. Okay, it is this forearm motion, and we talked about these terms a little bit in the beginning of the year. But pronation is turning your palms down, and then supination is turning your palms up. It's pretty straightforward. One of the ways that we sometimes tell people to remember things is that to supinate your wrist means that you turn them up like this, and that's how you can hold a bowl of soup. So supination, soup. Okay? I don't think there's a good opposite thing for pronation. I don't know what that is, but nonetheless, eversion and inversion, another very specific one. This is the corresponding movement to the foot. It's much less pronounced. You cannot totally pronate and supinate your foot because that would be just impractical and it would not allow you to walk. But you do something similar called eversion and inversion. And again, this is really difficult to do in this setting, but inversion means that you are turning your foot in like this. Okay, so it is actually going to, the sole of the foot is going to face the inside, your midline, and the opposite, the eversion, is where you turn the sole of your foot out towards the outside, laterally. Again, this may seem like an inconsequential movement, but it's really important in your ability to run and walk, especially over not smooth terrain. Rotation, the two joints that are, well, there's a couple joints, but the two main joints we're going to talk about here are the hips and the shoulders, and they have the ability to rotate. So it's easier to see when you actually bend your elbow like this, but when you can bend your elbow and then you can rotate, and then you can rotate back. Okay, so there's usually medial rotation is coming back to the middle, and lateral rotation out. Okay, the hip can do the same thing. Again, you can raise your knee like this and rotate out, and then rotate back. Okay, you can also talk about rotation with your spine, so you can rotate your spine. So that's another example. Protraction and retraction is a very unique movement, and there's not too many joints that have the ability to do this, but both your jaw and to a certain extent some of your vertebrae and your skull can do this. So I'll turn sideways here, but you can protract your jaw, stick it out, and then you can retract it, pull it back. It's a little bit difficult to see, I'm sure, in that video, but you can also protract your neck a little bit and retract your neck. The other one that sometimes people give as an example is you can protract and retract your tongue, which I think should be pretty straightforward. Elevation and depression. Again, we have a situation where you can take some joints and you can move them in the superior direction, so you can elevate your shoulders, you can depress your shoulders, you can elevate your rib cage when you breathe in and take a deep breath. You can depress your rib cage. You can elevate and depress your jaw. That's another good example, okay? So elevating your jaw is when you close your mouth, depressing your jaw is when you open it. Excursion, another very strange movement. It's sometimes referred to as lateral excursion. You're basically moving one joint to the side. So you move your jaw back and forth. It's kind of unique. I know I'm making funny faces. And you can use your neck can do that to a certain extent. I don't know of any other joints off the top of my head that can do that, but it's a pretty unique motion. Opposition and reposition, again, very straightforward. It's just with your hand, and the opposition is your movement of your thumb across your hand towards your pinky, and reposition is away from your pinky. It's, again, unique to that joint. That's the only one. The idea of an opposable thumb, that is unique to primates. Not many other animals have that opposable thumb. So, circumduction, again, a motion that is unique to just a few joints. I think the only joints in your body that can truly do this are your shoulder and your hip. So circumduction with your shoulder would be moving this complex motion around in a circle, and with your hip doing it would be moving all the way around like that. That's circumduction. Complicated movement. It's actually a bunch of different motions all put together, but it comes with its own name. Lateral flexion, it's just another name. It's similar to flexion and extension, but instead of the anterior and posterior direction, this one occurs to the right or left sides. So you can do this with the neck, you can do this with your waist, so flexion, lateral flexion to one side, lateral flexion to the other side. And it would just be described as to the right or to the left. Okay, so the neck can do that, the waist can do that. And then here's another video that I'm going to actually put in the other slide. So hopefully that was helpful, and I didn't look too silly making all those motions, especially with the ones with my face. So thanks for watching, and we'll answer any questions in office hours if we need to.